This second half, though, is going to be action-packed because you get to hear from both Bonnie and Amy, which I'm looking forward to the most, when we talk a little bit about supportive care and the voice of the patient. But just to introduce the notion of what we're trying to achieve in Baltimore and across the country, I'm going to take the next few minutes to walk us through a little bit, just 10 minutes, in what we've called changing the course of myeloma. That's why we've named this Empower Baltimore. We had a similar program in Charlotte. We're looking to do another program in Atlanta. And it's different in every city because every city is different, of course. But based on those facts that I shared with us at the start, those 10 features where myeloma is twice as common in the African American community, where outcomes are poor, the way we try to think of it is that course of myeloma, the way myeloma is going, is not acceptable. And we have to change that course. And part of the way we want to do that is to empower people and their caregivers and their families and indeed their communities to change that course. That's the essence of what we're trying to do. We think this workshop is just one small piece of that. For the 50 or so of you that are joining us today, we're so grateful that you're here, but we know that we can do so much more than a single workshop. So our empowerment mission across the whole of what we're trying to do, remember the International Myeloma Foundation is international, is to advance early and equitable access to myeloma information, when appropriate, screening and treatment in vulnerable communities worldwide. The focus, of course, today is within that whole sphere where we look at multiple groups. Some of those groups may be racially determined, like the African American group, or Hispanic patients, or maybe geographically determined by patients who live in more remote areas or in more urban areas. But today we're focusing in the Baltimore area, of course. And so our African American Initiative was really, say again, is one part of that whole greater empowerment mission, where we want to take the skills and the history that Kelly shared with us about the IMF for the last 31 years, working in the areas of support, research, awareness, and education, because we're embedded right within the community to try and find a way to make a difference. We know we can do this, and we want to be able to do it with you. And so our core vision is to improve the short and long-term outcomes of African-American patients through three primary ways: engaging the community, educating healthcare providers, and supporting patients. And that's part of what we're obviously trying to do in Baltimore and around the world, is to engage the community, to educate those in the early and accurate diagnosis, but also to support the whole hematology oncology community as we care for these patients. So what have we done? Well, we're bringing, obviously it's very difficult right now in the middle of a pandemic to do these live. We would love to do these live and in person, and that's what we had initially intended to do, but we all know the world has gone virtual and safety is paramount. So now, instead of necessarily bringing people to a physical workshop or a physical place, or being in a church or being in a barber shop or wherever it may be, we're trying to bring people to our website, which is the empowerbaltimore.myeloma.org. So this is part of our myeloma.org IMF website, where they can find the resources that would be valuable to them. What is myeloma? Do I have signs and symptoms that could be consistent with myeloma? What should my community and my church and my family know? What do I do if I know someone who has myeloma? How can I support them? Where can we get help? And we know that the University of Maryland, of course, is an outstanding myeloma center. And so we want to direct patients to there and to their healthcare system when they are in need. So to be empowered is to know the symptoms and the signs of myeloma, so that if you may have them, and again, we're not trying to frighten anyone or say you may or may not have myeloma today, but to know those things that I went over, that fatigue that is really significant, the anemia or the low blood cell counts, that bony pain, it really doesn't have an answer, that should be discussed. And we'll try on our side to help educate the doctors to know how to recognize it and how to do the right tests to be able to figure it out, and see if you need to be screened and tested for it, and talk to your families in the area. So this is part of what we believe is the empowerment. And so in our community outreach, I mean, I could list so many things here, but we've leveraged our social media during Black History Month. We've tried to create this toolkit at the website, where not only can people learn about myeloma, they can know, is there a support group near them? What really is myeloma? I do these videos on myeloma in 3 minutes. You know, what's the basics of myeloma? What are some of these other made simple things that we want to know? What is CAR T cell therapy that Dr. Badros shared with us? We have some great stories from one of our patients here who's also a nurse. Actually, Tiffany Williams shares a bit of her story. Amy, who you're going to hear with in a moment, has some information on our website about how your healthcare team can help you. How do you work with them? The days of 30, 40 years ago, when the doctor comes in the room and says, here, dear, you'll take this pill and you'll like it. I mean, those days are gone. This is, as Bonnie shared with us, this is a partnership. This is communication, open and honest. And we want to be able to make people empowered to be able to do those things. And so there are just a whole host of resources available at this toolkit website. I'm just giving you some of the highlights here so you can see many of these are videos. Some of them will just give you very specific help and resources for caregivers, resources in the world in which we live with drug reimbursement. Some of those drugs that Dr. Badros shared may sometimes be difficult. We heard that getting access to some of these novel therapies is more difficult within the African American community. So we want to connect you to the drug assistance programs that the companies may have, or that social workers may be able to connect you to. And sometimes people say, oh, well, I was a veteran, and so now you have access to the veteran benefits that you may not have thought you had. And there are lots of different ways to leverage the system so that we can do that. As I mentioned, of course, before, we have some great, very challenging and touching stories of real life cases so that people can see and understand how myeloma was overcome. I do want to make a couple of comments before I close off this part on education of the primary care doctors. I know I've mentioned this a few times before, that there's a longer time to diagnosis within the African American community. And so we really want to help the docs recognize myeloma, discriminate it from other diseases, sometimes like diabetes, which can have a lot of similar overlapping features to myeloma, and then do the right tests so that we can make the accurate diagnosis. Myeloma, we said before, is kind of like a crime scene, right? You can't just look at one thing. We need actually a few tests to help make this diagnosis, and then when we can refer on to hematology and oncology. We're also trying to help our teams for nurses and physicians. Amy, who's going to share with us in a moment, led a beautiful effort in writing a paper and teaching nurses about best practices within the African American community so that we can know the facts, that we can have practical tools for resources, that we can provide culturally competent care. When I watch Dr. Badros and the work that he does, he's really understood this, and being able to adjust to each of your patients and provide care to them in the way that they find valuable, in the way that's helpful to them. So maybe there may be a very important person, for example, in their family that really should be involved in a critical decision making. If I'm a culturally competent doctor, then I'm going to recognize that, do we want to call your uncle in? Do we want to bring your pastor in? Do we want to bring this person so that we can have a fulsome discussion so that you can feel confident in the decision that you're making? Those are the kinds of things that we want to encourage, and then of course when appropriate, clinical trial participation. So we're currently working in certain areas. As you see here, we've worked in Charlotte, we're now in Baltimore, but with time, we really hope to expand to many other areas, knowing that each area is different. We don't have some cookie cutter response. We don't have some belief that we can just descend in with a cape on and fix everything, but we want to help as much as possible. And we want you to join us in this. And if you've registered today, you'll be getting some follow-up notes and emails, and any way that you can engage with us would be deeply appreciated. So you can reach out to us through the website. We have an info line that runs all day during the day. There's the Empower website. And then of course, working today with our dear friends at the University of Maryland, we've included their website and their phone number. Although I know many of you are already connected to them in case this may be of benefit to you.